Welcome to today's presentation. Today, I want to talk about Introduction to Body Mechanics. Body mechanics refers to how we coordinate our body parts to produce movement and keep our balance while we're active. It's really about using our body efficiently and safely. Understanding proper body mechanics is especially important for nurses, since we perform many tasks that require lifting, moving, or repositioning patients. When we use correct techniques, we can perform these tasks more safely, not just for ourselves, but also for our patients. Most importantly, practicing good body mechanics helps us prevent injuries, like strains and sprains, that can happen when we don't pay attention to how we move. So, mastering these principles is essential for maintaining our health and ensuring safe patient care throughout our shifts. Let's take a moment to go through the objectives for this part of our training. First, we want to understand the principles of body mechanics. This means knowing how to move and position ourselves and our patients in ways that minimize strain and injury. Next, we'll learn how to apply correct positioning techniques for our patients, which is essential for their comfort and recovery. An important goal is preventing complications that can arise from immobility, such as pressure ulcers or muscle atrophy. And finally, we need to ensure safety and comfort, both for our patients and for ourselves, by practicing proper techniques. Keeping these objectives in mind helps us provide the best care possible while maintaining a safe working environment. Let's talk about the principles of body mechanics. First, maintaining a wide base of support, which means keeping your feet apart, helps improve stability and balance when you're lifting or moving objects. Next, it's important to keep your back straight and bend at the knees, not at the waist. This way, you're protecting your back from strain and using your leg muscles more effectively. When lifting, always keep the object close to your body. Holding things close reduces the strain on your back and makes lifting safer. Avoid twisting or jerking movements because these can cause injuries or strain your muscles. Instead, move smoothly and with control. Remember, use your strongest muscles, your legs, rather than your back. That's a key point because your legs are better suited for lifting and supporting weight. Whenever possible, work at waist level. This helps keep your body in the proper position and reduces unnecessary strain. All of these principles connect to our overall goal, working safely and efficiently to prevent injuries and promote good health in the workplace. Let's talk about the importance of good body mechanics. First, it's crucial because it helps prevent muscle strain and back injuries, which are common issues among nurses due to the physical demands of our work. By using proper techniques, we can protect ourselves while providing care. Good body mechanics also promote effective and safe patient handling. When we move patients correctly, it reduces the risk of injury to both the patient and ourselves, ensuring everyone stays safe during transfers and repositioning. Additionally, applying these principles increases our efficiency and comfort during procedures. When we move with proper form, tasks become smoother and less tiring, which improves our overall performance. And finally, good body mechanics directly enhance patient safety during transfers and positioning. Proper handling reduces the risk of falls or injuries, making sure our patients are cared for in the safest way possible. Overall, mastering good body mechanics is a key part of providing quality care while protecting our own health. Now, let's take a look at some common patient positions that you'll encounter in clinical practice. First, we have the supine position, also known as dorsal recumbent. In this position, the patient lies flat on their back, which is often used for examinations and procedures that require access to the front of the body. Next is the prone position, where the patient lies on their abdomen with their head turned to one side. This position is useful for certain surgeries and spinal assessments. Then there's the lateral or side-lying position. As the name suggests, the patient lies on one side, which is commonly used for assessments like lung sounds or for patients who need to be turned for comfort or pressure relief. Finally, we have Sims position, which is semi-prone, meaning it's somewhere between lateral and prone. The patient is positioned partly on their side and partly on their abdomen. This position is often used for rectal examinations or enemas. Understanding these positions is essential because each one plays a specific role in providing proper care, ensuring patient comfort, and facilitating accurate assessments. When you connect these positions to the overall theme of patient-centered care, you'll see how important it is to select the right position for each situation to promote safety and comfort. Let's talk about the purpose of patient positioning. First, it's essential to maintain proper body alignment and comfort. When we position our patients correctly, it helps prevent unnecessary strain and keeps them comfortable during care. Next, proper positioning is crucial to prevent pressure ulcers and contractures. By shifting positions regularly and ensuring proper support, we reduce the risk of skin breakdown and joint problems. It also promotes lung expansion and improves circulation. Good positioning allows the lungs to expand fully, which is especially important for patients with respiratory issues, and it helps circulate blood effectively throughout the body. Lastly, positioning is vital to assist with medical examinations and procedures. Correct positioning makes it easier for healthcare providers to perform assessments and treatments efficiently and safely. Overall, proper patient positioning supports health, comfort, and effective care, which aligns with our goal of providing high-quality, compassionate care. Today, I want to talk about the nurse's responsibilities during patient positioning. First, it's essential to clearly explain the procedure to the patient. This helps reduce anxiety and ensures they understand what's happening. Maintaining privacy and providing proper draping is also crucial to respect their dignity throughout the process. Using correct body mechanics when positioning the patient not only protects your own safety, but also ensures the patient is moved smoothly and comfortably. As you position the patient, keep a close eye for any signs of discomfort or distress. These cues are important to address immediately. Supporting weak limbs with pillows or specialized devices can make the patient more comfortable and prevent injury. Overall, these responsibilities are all about providing safe, respectful, and effective care, which ties into our broader goal of promoting patient well-being and safety in every step we take. Now, let's talk about assistive devices for positioning. These tools are essential in helping us maintain proper body alignment and prevent pressure injuries. For example, pillows, sandbags, footboards, and trochanter rolls are commonly used to support different parts of the body and keep patients comfortable. Bed blocks, side rails, and draw sheets are also important. They help with turning and repositioning patients safely. For those who are dependent and require more assistance, mechanical lifts or sliding sheets can make a big difference in reducing caregiver strain and ensuring patient safety. Overall, these devices are vital in promoting comfort, safety, and proper positioning, which are key themes in providing quality care. Let's talk about some key strategies to prevent back injuries in nurses. First, always use assistive devices whenever they are available. These tools are designed to help reduce the strain on your back during patient care. Remember, don't try to lift or move heavy patients alone. Asking for help is crucial. Working together not only makes the task safer but also more efficient. Next, incorporating regular back strengthening exercises into your routine can make a big difference. Stronger back muscles provide better support and resilience against injury. And finally, maintaining correct posture while working is essential. Good posture reduces unnecessary stress on your spine and helps you stay comfortable throughout your shift. By applying these practices, we can protect ourselves and ensure we stay healthy and effective in providing care. Now, let's talk about some of the complications that can arise from poor body mechanics. When proper techniques aren't used, it can lead to back pain or even spinal injuries, which can be quite serious and impact a person's mobility. Muscle strain or fatigue is also common, and over time, this can cause discomfort and decrease overall strength and endurance. Poor body mechanics can also increase the risk of falls or injuries to patients, especially when transferring or repositioning them. This not only affects the patient's safety, but also places caregivers at risk. Additionally, improper positioning can lead to the development of pressure sores, which are painful and can become serious if not addressed promptly. The key takeaway here is that maintaining good body mechanics is essential for protecting both ourselves and our patients from these avoidable complications. It's all about being mindful and using proper techniques to ensure safety and promote healing. Let's take a moment to summarize what we've covered. Good body mechanics and correct positioning are absolutely vital for safe nursing care. They not only help us perform our tasks effectively, but also protect us from injury over time. Remember, as nurses, we have a dual responsibility. We must safeguard our own health while also ensuring our patients are comfortable and safe. To achieve this, regular training and maintaining awareness are key. Staying up to date with proper techniques helps us prevent occupational injuries, which can be a real challenge in our line of work. Overall, by consistently applying these principles, we contribute to a safer environment for both ourselves and our patients. Let's take a moment to look at the references that have supported this presentation. First, we have Potter and Perry's Fundamentals of Nursing, 10th edition, which provides a comprehensive foundation in nursing principles. Then there's Cozier and Erb's Fundamentals of Nursing, 9th edition, another key resource that covers essential nursing concepts thoroughly. We also reference the Indian Nursing Council's Nursing Foundation syllabus, which guides the educational standards and core competencies required in the field. Lastly, the World Health Organization's Guidelines on Safe Patient Handling from 2021, which emphasize the importance of safe practices to protect both patients and healthcare workers. These sources collectively reinforce the importance of evidence-based practices, safety standards, and foundational knowledge in nursing. They connect directly to our overall theme of delivering safe, competent, and compassionate care.